Hi, this video is the demonstration of the FUT linear scar, and I trying to demonstrate as much as I can for both the FUE and FUT, but this video is the FUT strip linear scar and running from one ear to another ear. And this client had 2 procedures done in the past, and this is his result. No surgery are perfect. Some result vary from one individual to another. Some people's scar can stretch bigger. Sometimes the patient's body heals so well that the scar is so small that they can make the surgeon look better than he is. Or sometimes the client genetically they produce bigger scar and the scar stretch, and they can make the surgeon look worse than he is. So the scar can stretch, but this is a year follow-up, and this is after second patient had 2 surgery. Again, there's pro and con for both FUE and FUT. FUE had tiny dots of scar scattered throughout the back like a mosaic pattern, allow you to wear your hair shorter. But the FUT has a linear scar, so you cannot wear your hair short. The other downside of FUTs are more invasive, more painful, more bleeding, more chance of infection versus the FUE. But the pro of the FUT is very good for advanced hair loss, class 4, 5, 6, or 7. They move over 4,000, 5,000 grafts per day, and you reach your goal faster. So bigger case, it can move more efficient than the FUE. It's cheaper, and it grows 5 to 10% better than the FUE. Where the FUE, the pro and con are: the pro of the FUE leave minimal scar, allow you to shave your head shorter, less invasive than the strip method. The FUE are less painful, less bleeding, less chance of infection. But the downside of FUE is the cost is more expensive. The number of grafts we can do is less. It's good for mild to moderate hair loss. It can do advanced hair loss, but you need multiple surgery. And besides the cost, the number of grafts we can do is less. So this is the demonstration of FUT linear scar. The result can vary from one individual to another. No surgery without scar. All surgery produce scar.